Today, we're diving into a real medical detective story. We're talking about a painful, baffling condition that is one of the toughest diagnostic puzzles in all of medicine. So, let's get into our investigation. You know, this quote just nails it. For both the person suffering and the doctor trying to help, figuring out complex regional pain syndrome, or CRPS, isn't some quick, easy test. It's a long, frustrating, and uncertain journey.
All right, here's our game plan. First, we'll define what this mystery is all about. Then, we'll look at the official rulebook doctors use to diagnose it. We're going to sift through real clues and false leads, look at the serious risks of getting it wrong, and finally, figure out how to crack the case before it's too late.
So what is this condition that's so tricky to pin down? Let's get right to the heart of this painful puzzle.
Okay, imagine you sprain your wrist, a simple sprain. But instead of healing, it starts to burn with this horrible, agonizing pain that is just completely off the charts. That right there is the classic sign of CRPS. It's a chronic condition where your nervous system basically goes haywire and starts blasting pain signals that are way more intense than the injury ever called for.
And this is really the core of the whole problem. You have this potentially life-altering condition, but there's no blood test, no x-ray, no single scan that can give you a firm, yes, this is CRPS. The entire diagnosis comes down to what a doctor can see with their own eyes and what a patient can tell them.
Now, to try and bring some kind of order to this diagnostic chaos, experts came up with a very specific set of rules. Think of it like the official detective's manual for spotting CRPS. It's called the Budapest criteria.
These criteria follow a really clear four-step logic. First, the patient has to have that ongoing, disproportionate pain. Second, they have to report a specific set of symptoms. Third, the doctor has to actually see a specific set of signs. And fourth, and this one is huge, they have to rule out everything else it could possibly be. And this difference is absolutely critical to getting the diagnosis right. It's not enough for a patient to just say they feel something, like, my hand feels swollen. For the diagnosis to be made, the doctor has to physically see it. They have to observe that the hand is actually swollen. You need both the subjective feeling and the objective proof.
So this table breaks down the exact evidence doctors are looking for, and it's split into 4 categories. The patient needs to report symptoms in at least 3 of them. We're talking about sensory stuff like being incredibly sensitive to touch, vasomotor changes, which means things like skin color or temperature are off, pseudomotor, which has to do with sweating or swelling, and motor issues like weakness or finding it hard to move. But here's the key. A doctor only needs to see signs in 2 of those categories. It's a really strict checklist for a reason.
Okay, so if the diagnosis is all about observation, what about all those other medical tests? Well, this is where our investigation can get really tricky. They can give you clues, sure, but they can also be total red herrings. This really shows you the double-edged sword of our modern tests. A bone scan might show some changes, yeah, but that's not definitive proof of CRPS. An MRI is great for making sure it's not something else, but it can't actually find CRPS. And an EMG, which checks nerve health, is important for figuring out different types of CRPS, but it can't confirm the diagnosis by itself. Every test gives you a piece of the puzzle, but none of them give you the whole picture. And here's the fundamental problem. We're often using tests designed to find structural problems, like a broken bone, to try and diagnose a functional problem, a disorder in how the nervous system is actually working. It's like trying to find a software bug by taking apart the computer. You're looking in the wrong place, and it often leads down what the research calls a fruitless pathway, just wasting precious time and money.
So with all these hurdles, you have to wonder, how often does the diagnosis actually go wrong? The answer is pretty shocking. The numbers are just staggering.
40 to 80%. Let that sink in. According to research from places like Johns Hopkins, that's the percentage of chronic pain patients who are initially misdiagnosed. This isn't just a small margin of error. This is a full-blown systemic problem. And even when you zoom in just on CRPS, the problem is still there. The new Budapest criteria definitely helped, bringing the rate of overdiagnosis down from a whopping 59%, but it's still at 32%. That means almost 1 out of every 3 people told they have CRPS might actually have something else going on.
So why is this happening? Well, sometimes doctors just don't fully rule out other things, or they use CRPS as a kind of catch-all diagnosis for any weird limb pain. But here is the most stunning fact of all. In some studies, between 71 and 80% of patients told they had CRPS actually had a different, very treatable problem, a simple pinched nerve that was never found.
When a diagnosis is delayed or missed or just flat out wrong, the consequences aren't just frustrating, they can be devastating. Because with CRPS, the clock is always ticking.
Just look at this timeline. It shows you how incredibly narrow that window of opportunity really is. Your best shot at effective treatment is in the first 3 months. After a year or so, the condition can become chronic, as those pain signals get hardwired into the brain. And if you go past 18 months, the risk of permanent, irreversible damage just skyrockets.
The physical cost of that delay is just awful. We're talking about bones deteriorating, muscles wasting away, and permanent nerve damage. The pain itself can spread to other parts of the body, and in the most extreme, heartbreaking cases, amputation becomes the only option left. And on top of all that, you have the severe psychological toll, the deep anxiety and depression that comes with it.
So after all of these challenges and these grim statistics, what's the solution? How do we solve this diagnostic mystery before that window of opportunity slams shut?
Well, it turns out the answer isn't some futuristic scanner or a magic bullet test. It's much more human than that. It's skilled, old-fashioned clinical detective work. A doctor who knows the patterns and spots them early, teamed up with a fast, coordinated response from a whole group of specialists.
When CRPS is suspected, experts agree these 3 steps are absolutely critical. First, immediately start gentle rehab to get function back. Second, get an urgent referral to a specialized pain clinic. And third, bring in psychological support from day 1 to help the patient handle the enormous physical and emotional burden.
And that leaves us with this one last big thought. Diagnosing something like CRPS isn't just a science of checking off boxes, it's an art. It takes listening, it takes careful observation, it takes intuition. And the real question for our medical system is this: are we training enough artists to see the clues before it's too late?